In medical coding, accurate documentation is essential for correct billing, reimbursement, and reporting. Three key components in achieving accuracy are modifiers, coding guidelines, and sequencing rules. Understanding these elements ensures that coders correctly represent the services provided, capture the complexity of patient care, and comply with official coding standards. Modifiers are two character codes used in CPT and HCPCS to provide additional information about a service or procedure. They do not change the definition of the code itself but clarify circumstances such as multiple procedures, distinct services, or unusual events. For example, modifier 59 indicates a distinct procedural service, meaning a procedure was performed separately from another related procedure on the same day. Modifier 25 is used to show that an evaluation and management M service was performed on the same day as a procedure and is significant and separately identifiable. Proper use of modifiers prevents claim denials and ensures appropriate reimbursement. Official coding guidelines serve as the foundation for accurate and consistent coding. For ICD-10-CM, guidelines define how to assign primary and secondary diagnoses, capture complications, and code comorbidities. CPT guidelines focus on procedure coding rules, use of modifiers, and documentation requirements. Adhering to these guidelines ensures compliance with CMS, AMA, and payer regulations, while also supporting clinical documentation improvement and accurate healthcare analytics. Primary versus secondary diagnosis and sequencing rules are critical in both ICD 10 CM and CPT coding. The primary diagnosis identifies the main reason for the patient encounter or service, while secondary diagnoses describe coexisting conditions, complications, or additional reasons for care. Proper sequencing of diagnosis affects reimbursement, risk adjustment, and quality reporting. For inpatient coding, the principal diagnosis is the condition primarily responsible for the admission, whereas secondary diagnoses are coded to reflect comorbidities or complications that impact patient care. Following sequencing rules ensures accurate claims and reflects the patient's clinical picture correctly. In summary, effective use of modifiers, adherence to official coding guidelines, and correct application of diagnosis sequencing rules are essential for precise medical coding. Modifiers clarify procedural circumstances in CPT and HCPCS. Guidelines provide standardized instructions for coding practices, and sequencing rules distinguish primary and secondary diagnoses to accurately reflect patient care. Mastery of these concepts reduces claim denials, improves reimbursement accuracy, and ensures compliance with regulatory requirements, ultimately supporting a more efficient and effective healthcare system.